Hepatitis. Let's take a brief look at the job of the liver. It plays a part in the storage of minerals and vitamins. It metabolizes bilirubin. It synthesizes some of the clotting factors. It helps in the metabolism and storage of nutrients. And it's also responsible for metabolic detoxification. Let's go to the first one, bile. Bile is secreted by the hepatocytes, which are cells in the liver. And bile is needed for fat emulsification and absorption. That means without the bile, the body has a really hard time absorbing fats. When the hepatocytes are damaged, bile production is inhibited and fat absorption is affected. Bilirubin. Bilirubin is a part of bile, but let's look at what else it does. The liver breaks down older damaged red blood cells into bilirubin. Then it conjugates it so it can be passed from the body via the stools. So the liver has to break down the red blood cells, change it, and then the body can get rid of it through the GI tract. If the liver is damaged, that part where the bilirubin is conjugated doesn't take place or has a hard time taking place. So yes, the red blood cells are broken down into bilirubin, but it can't go anywhere. So it builds up in the skin and the sclera of the eyes. That's that yellow discoloration, and that's called jaundice. This is a description of what happens in the icteric phase of hepatitis. Let's look at liver and glucose. The liver takes up and stores glucose as glycogen in times of hyperglycemia. If there's too much sugar in the blood, the liver takes it and stores it as glycogen. The liver then releases glucose in times of hypoglycemia. Not enough sugar in the blood to provide the energy the body needs, the liver will release it. It takes that glycogen and turns it back into glucose. Detoxification. The liver helps to metabolize toxic substances, and that includes alcohol and medications. Viral hepatitis. Hepatitis is spread via the fecal-oral transmission or blood and body fluid transmission. Well, blood and body fluid transmission, that's blood and body fluids. Transfusions, sharing needles. The fecal-oral transmission is somebody didn't wash their hands after they went to the bathroom. Then they went and probably fixed some food, fed it to somebody else, and that somebody else ate it and got hepatitis. The fecal-oral transmission is the means for type A and E to be spread, and types B, C, and D are spread via blood and body fluids. Now, hepatitis ranges from being a very mild disease to liver failure and death. There are vaccines available, but only for types A and B. Hepatitis is a virus. It enters the hepatocytes in the liver. And remember, when a virus enters cells, they take over the normal cellular function and change it so that they don't function like healthy cells anymore. That all the cells do is replicate more virus and spread it on. This is going to lead to hepatocyte necrosis, death of hepatocytes. And this is in varying degrees depending on the severity of the disease. The Kupffer cells within the liver, we've got hyperplasia. Remember, that means there's a lot more cells being formed. A lot more of these Kupffer cells are being formed, and their job is to remove the necrotic tissue in hepatitis. The hepatic cells regenerate, and that starts about 48 hours after the injury. The inflammation process can damage and obstruct the bile system, leading to jaundice. Okay, think back to the inflammatory system, vasodilation, increased vasovascular permeability, and edema. All that's going to lead to obstructing the bile system. The damage tends to be most severe in cases of hepatitis B and C. Hepatitis B is also associated with acute fulminating hepatitis, a rare form of the disease that is characterized by massive hepatic necrosis. Severe acute obstruction of blood vessels then occurs, ending up with tissue hypoxia in the liver, tissue death, and hepatic failure. Okay, the course of the disease. The incubation period for hepatitis is 1 to 3 months. The prodrome lasts about 2 weeks. And as you look at the list of symptoms here, don't they look like a lot of other diseases, prodromes? Fatigue, anorexia, malaise, headache, low-grade fever, just not feeling good. The clinical illness is called icterus in hepatitis, and it lasts 2 to 6 weeks. 2 weeks after exposure, we may see jaundice, dark urine, clay-colored stools. Okay, what is that from? Remember, we've messed with the bile system. We're getting hyperbilirubinemia, too much bilirubin building up and not getting conjugated. Well, if it's not conjugated, it can't get passed out in the stools, and bilirubin has a very dark brown color. So we're missing that dark brown color, you get the clay-colored stools. Some of the bilirubin will be passed through the urine. Not much, but it's enough to darken the urine. We'll also see the liver enlarge and be tender. The recovery phase, the jaundice goes away about 8 weeks after exposure, and signs and symptoms start to diminish, but the liver enlargement and tenderness takes another 1 to 4 weeks to go away. Now, as the symptoms go away, some people are essentially cured of the disease, some people are not and remain carriers of the disease. They can pass it on to somebody else. They may not have the acute disease, they've got a chronic condition where they can pass it on to someone else. All right, let's go back to the liver function things we talked about in one of the earlier slides and compare it to liver failure. Well, the liver is supposed to secrete bile, which plays a role in fat absorption. So if we have liver failure, we're not secreting bile as we should, and we can't absorb fats the way we're supposed to. That is going to interfere with the storage of minerals and vitamins. Remember, a lot of them are fat soluble. The metabolism of bilirubin has been altered in liver failure, so we see jaundice. Part of the job of the liver is to synthesize clotting factors. Well, in failure, that's not happening, so we're going to see bleeding. The liver is supposed to help metabolize and store nutrients, and that includes glucose. So, if we're messing with that glucose to glycogen storage process, we're going to end up with more hypoglycemia in people because they don't have the stored glycogen to call on. The liver is also supposed to help detoxify the blood. Well, if the liver's not working, you're not doing that real well, any medications we give people are going to build up very quickly, and the medications themselves are going to become toxic.